So welcome, everyone. It's so good to see everybody here. I'm Marie Abraham. I'm the Vice President for Programming and Publications for the Institute for Patient and Family-Centered Care. And I'm joined today by Dr. Barbara Lewis, who is going to share her amazing expertise and work on evaluating and measuring outcomes of the impact of PFACs and PFA programs. So Dr. Lewis has recently completed her dissertation on this topic, and she received her PhD. So congratulations, Barbara.
Thank you.
And as I said before, please feel free to chat in your name, your organization, where you're located. We are recording this conversation so we can share with others who registered for the recording, and we will be posting it onto our website. While we love seeing faces, if you prefer, you can go off camera while the presentation's going on. Next slide, Matt. So we just want to acknowledge our PFCC Connect sponsors. Thank you, Kaiser Permanente and University Health, for your support of PFCC Connect. Without your support, we would not be able to continue these informative and inspiring conversations. So much gratitude to you. Next slide. Right. So as you know, our conversations are intended to be interactive and informative, and the presenter will be sharing slides to set the context and provide information to get the conversation started. It might take a little longer this time, but we'll deep dive into the discussion portion. We just want to remind everybody of our group agreements. Be present as possible when we move into discussion. It would be great if you could go on video. Participate actively. We encourage you to be curious, ask questions, share your experiences, your perspectives, and any challenges you've faced. You can either chat in your questions or ideas or raise your hand, and we will call on you. Let's share space, allow others to contribute to the conversation, embrace a learning and growth mindset. All of you bring expertise. It's not just us, and we have a lot to learn from each other. And finally, we hope you enjoy the discussion and have fun. Next slide, Matt. Oh, and if you have any technical issues, you can directly chat to Matt. So thank you to all who shared questions and comments when you registered. And here are some of the issues. They're not all of the issues, but here are some of the issues that we learned about what you are most interested in. So what metrics can be used to measure the impact? How do we get leadership buy-in to support PFACs and PFA programs? How can we build the ROI and the business case? What are best strategies for integrating PFA feedback into adapting policies and practices? Can a qualitative analysis be used to evaluate and measure the impact? And how can we identify and recruit organizational champions who will be supportive of this work? And hopefully we'll be able to get to many of these issues today. Probably not all of them, but hopefully we'll get to some of them. Next slide. So why is evaluation important? Here are two quotes, and you might have seen these before on previous informal conversations. One is from Dr. Lewis. That's the first one in the light blue. And then one is from Dr. Anjana Sharma. And with that, I'm going to hand it over to Barbara Lewis.
Thank you so much, Marie. I really appreciate the introduction. Let me share my slides now. So before we get started, I just wanted to mention to you why I'm involved in this work, my personal journey. I spent 2 weeks in the ICU with my sister in 2012, and she had been admitted with an unknown infection. And I was a former journalist. I was writing at the time for the Wall Street Journal and a number of other publications. I was also teaching. I was teaching primary research at UCLA Business School, And I would come to the meetings every morning, the family meeting, and I would talk about what I had discovered the day before in all the research that I had done. And no one was listening to me, and they were very dismissive. And in fact, one hospitalist said to me, "We'll stop that medication if you want your sister to die." I did find out from nurses that eventually all of my recommendations that I had made that were never accepted were finally adopted days later. But unfortunately, it was too late for my sister and she passed away. So I came away from that experience and I asked myself, where is the patient voice? And I started doing some research, and I found that patient and family advisory councils, otherwise known as PFACs, were indeed embodying the patient voice in hospitals. So I contacted my local hospital, which was Kaiser Permanente, and they had a PFAC. And by the way, they have PFACs in all of their medical centers, about 100 PFACs altogether. I joined that, and then I was on the regional Southern California PAC, Patient Advisory Council, and also selected as the first chair of the Barrel Institute Global Patient and Family Advisory Board. So I was on a conference call one day, and the person said that the CEO refused to start a PFAC because there was no business case. So, armed with my MBA and lots of business cases that I had written previously, I got a grant from the Barrel Institute and found anecdotally that PFACs were really quite effective. And then about 5 or 6 years after that research, I thought, well, this research is getting kind of stale. What if I go back to school and get a PhD and focus my dissertation on patient and family advisory councils, which to my knowledge had never been done before as a PhD dissertation. And I found that PFACs are extremely effective and that they save hospitals money, improve safety, and enhance the patient experience. And by the way, if any of you are thinking of going back to school, I highly recommend it because this muscle in my head called the brain got a great workout, which was really wonderful. So the three studies that I did in my mixed method research for the PhD is I did a literature review first. I wanted to find out what was out there in terms of articles written about PFACs. And I read hundreds of articles and narrowed them down to 143. And I decided to look at them from around the world because I didn't want to just focus on PFACs in the US in this first literature review that I did, or this first study that I did. I really wanted to look at the rest of the world and see what was out there. And I found that nurses had written articles that appeared in 15% of all the articles, the 143 articles, were in nursing publications, and that there were a number from around the world that were also written up, which I thought was quite interesting. And to our Canadian friends, there were a number of articles also from Canada as well. So the second study that I did was a qualitative study, and here I interviewed 20 leaders in hospitals about their PFACs. Both of those have been published in the Journal of Patient Experience. And the third one, the quantitative study, has been accepted for publication. I expect that it'll be published within the next couple of weeks. And that was a survey that was filled out by 220 people who worked for US hospitals. And I'm going to be sharing that research as part of this. So we're talking today about measuring the accomplishments and the impact. So the value of measurement is that it actually proves the concept that you should have a PFAC. Why should you have one? Well, you had certain measurement, and it proved that you should have a PFAC. In the original research that I had done, which was 10 years ago, I found that 3 hospitals had eliminated their PFACs. And I went a little crazy. I thought, oh my gosh, I'm working to have a PFAC in every hospital, and now we have hospitals that are eliminating them. So I went to the hospitals to ask why, and each one of them had a new CEO. And I thought, oh, the new CEO comes on board, says, what is this PFAC and what do they do? And there was no proof of concept. There were no projects that were measured of saving money, improving safety, or enhancing the patient experience. So the Agency for Healthcare Research Quality has these three measurements on their website. And these measurements were developed by a very well-known researcher by the name of Donna Bedian. So the first type of measurement is process, and everybody should be doing process measurement. This is the numbers, actually. So the number of meetings that you have a year, the number of PFAC projects that you've had, the number of hours that your volunteers spent in meetings or on committees, for example. So process measurement is something that everybody should be doing. Structure is more on the not the activity side, but more the capacity. And this is increasing the number of PFACs, for example, by 20% by using a toolbox. And maybe you're saying, oh my gosh, no, I can hardly handle the PFACs that we have. I don't want to increase the number. But the person that I interviewed who had 30 PFACs in one standalone hospital was using a toolbox, and a ton of departments were coming to them and saying, we'd like to start one. We've heard about how great it is, how much impact they're having. We want to start. So they developed a toolbox, and I'm going to be sharing that research as in the future, probably in a couple of months, because it's quite interesting. And the final one, which is the gold standard, is the outcome, and that's about the impact. So that's looking at the measurement before the PFAC is involved, then we have the intervention with the PFAC, and then measuring afterwards. And what kind of impact did the PFAC have? So for example, let's talk about those very complicated colonoscopy directions where many people got to the reception area and found out that they couldn't have the colonoscopy because they didn't follow the directions. So the directions then are brought to the PFAC tears it apart, has all new directions. And now with the new directions, those cancellations have decreased a huge amount. And all of this, it is tied to money. So for example, we can tie money to all of this. So outcome is not just the pre and post measurement, but it's what was the financial impact as well. So it's very important to have an annual report for executives on the accomplishments. But I look at this more than just annual, and I'm saying monthly is better. Let's put something in the monthly hospital newsletter every month about the impact that the PFAC is having. So what can you measure in a PFAC? So first of all, you can measure the feedback from the presenters, the departments who come to you, or the leaders who come to you, who make a presentation. What did they think about it? We can also ask for feedback from the members. What did they think of the meeting? And finally, where the gold standard is and the outcome measures is we can measure the initiatives. Now, not all initiatives can be measured, but many of them can, but most of them are not. So let's look at some research results. So how often do you track process measures? So remember, this is a number of meetings, a number of initiatives, a number of hours. Always about 1/3 always track process measures. But here we have never, rarely, occasionally, sometimes. Every PFAC should be tracking these numbers, whether the number of meetings, the number of people, whatever it is, important to put in a final report or even monthly to talk about the success of the PFAC and what the PFAC is doing. So another question on the survey was, how often do you track outcome metrics? And here that number is much lower. Only 10% always track outcome metrics. And look how many never or rarely. We're talking about over 50% are never measuring the improvement in patient experience scores or reduction of falls or something like that. Okay, let's go on to these are some of the initiatives that I found, outcomes and responses. So in the left column, you see the initiative. The middle is the PFAC recommendation, and then is the outcome, and most of these are quotes. So almost all of these have some kind of metric that could be tied to it, but many of the people didn't know what that metric was, for example. So in their annual report, or report to leaders if they're giving, they may not say, here's what we did. We're in the 90th percentile with the food, but what were the low scores initially? And what was that difference? It's what we wanted talk about the difference of before the PFAC brain was used and after they came to the PFAC meeting. So hospitals can save money by using the PFAC. They can improve safety and enhance the patient experience. And improving safety and enhancing the patient experience are both tied to money as well. We're just not thinking about what we can do when a department brings an initiative to us, which is sort of a shame. So, how often do you obtain feedback from the department about their experience? Only 4% said always. This should be a mandate for hospital employees on PFACs that every time someone comes and makes a presentation, that you ask them about their experience. One, so that you can improve it, but two is so you'll have that metric of what's happening when they come. Is that quantitative? Are we measuring by numbers, or is it qualitative where we're asking them? So most of it is qualitative. Almost 50% is qualitative. So we're asking questions like, what did you think about it? Instead of on a scale of 1 to 5, how would you rate the following? It really should be both, though. We should ask every department that comes to us questions that are both quantitative and qualitative. And here's an example of a department survey. So you see on the top, it's quantitative on a scale of 1 to 5. How would you rate the following? 1 poor, 5 excellent. The meeting pre-planning, the meeting discussion, the value, the impact, your interest in bringing other projects to the PFAC. This is great information to have for not only the annual report, but for the PFAC to know about. And then the testimonials are below, and that's the qualitative. How would you describe the benefit of the PFAC's feedback? What was the most impactful idea that you heard at the meeting? So this is a survey or something similar that should be given to every department that comes to the PFAC, or every person that presents an initiative at the PFAC. Okay, how frequently is the department's implementation of PFAC advice shared with the council? This was really surprising to me that only a little over 1/4 of all PFACs are always sharing advice. And the ramification of this is that if you're not doing this, the members may lose interest. And the sharing is what we call closing the loop, right? So one person said to me, well, we really don't need to do that because the all of our implementation can be seen in the hospital. And when the PFAC members go into the hospital, they see what their impact was. And I'm thinking, no, we should not expect the PFAC members who have donated their time, their energy, and their mind to helping us improve, and expect them to wander around the hospital and see the results of that. And another person told me that she had her best PFAC member was resigning from the PFAC, and she had an exit interview and found out the member was leaving because they did not think that they had any impact. You know, I give you all this advice, all these recommendations, and then I never hear if anything is implemented. He said, I want to be in a volunteer group where I know my impact. So this is so important to share the advice of the council. And I think that if you're doing that, that if you are having part of the meeting for new projects and another part of the meeting for projects that happened before, I think that there will be more people attending the meetings because they want to know what the impact was, and you've got a part of the meeting dedicated to that. And it'll be easier to retain people as well, and maybe even recruit. You know, here is a list of all of the impact that our PFAC has had over the last year. How much would that help with recruiting if we were talking about closing the loop constantly with our PFAC members? How do you promote the accomplishments? So we have 8% down here who never promote the accomplishments. What a shame. We're not telling the PFAC about what's happening. We're also not telling the leaders about what we're doing. And then how often do you, well, one is how do you promote? Okay. And this one then is how often do you promote? And the majority have this annual report that they do. But in reality, we really should be doing this monthly, because what I discovered in the research is that the more visibility that a PFAC has, the more content that it gets. And there are a number of hospitals with whom I spoke that don't have enough content. They run around right before the agenda is ready to be set, and they try to find something in the hospital to bring to the PFAC. And if you're in that position, one of the ways that you can automatically get more content is if you have something that goes into your monthly hospital newsletter, for example, about what you're doing and what department came. And then 3 months ago, we had this department, and here's the impact that we had, the recommendation and the impact. More visibility, more content. So why are metrics important? And I put together the PFAC ecosystem here. So you can tell patients that we listen. So when there were a high number of complaints about the food, and we brought in the chef and we looked at the menu and we gave a lot of impact, and now our scores are in the 90th percentile for food, you can tell the patients that that's an example. We listen to our patients. Patients want to know that they're listened to. Well, you're listening to their suggestions that they have on how to improve safety and enhance the patient experience. Then you want to make sure, of course, that you're telling the hospital about the metrics. So it could increase the amount of content, which I mentioned, but also increase your budget. Imagine if you're saying that you help to decrease the number of falls, and falls are, in the research, are approximately 15,000 to 65,000. That's what it costs a hospital. And if you decrease the number by a certain amount, what does that equal in money? Okay, so maybe there might be a budget, and maybe you might be able to start paying the PFACs for lending their brain to the hospital. Finally, you want to go out to the community and talk about your patient-centeredness, and with real examples of what happened, that here was a problem that was brought to us, we solved it, and here's the results of it, and we're patient-centered, we're listening to you. And you can tell the hospitals in the world as well. So this is important to the accreditors, and they are going into hospitals like the Joint Commission, for example, and they're interviewing PFAC members and asking them about their experience. You might know that CMS has 5 domains that hospitals have to attest to, and the 5th domain is patient engagement. And in that description of patient engagement, CMS mentions patient and family advisory councils. And finally, we have the HCAHPS patient satisfaction surveys that are done. And those surveys in my research have increased as a result of what the PFAC has done. So HCAHPS scores. And how good would it be for your career to be talking to the leaders of the hospital about all of the examples you have where you've actually measured the before and after and tied it to improving safety, saving money, and enhancing the patient experience. So I wrote an article for the Journal of Patient Experience called The Success of Patient and Family Advisory Councils, the Importance of Metrics, so you can read more about how to measure. And here's my contact information if you would like it. You can follow me on Barbara Lewis, PhD, on LinkedIn. Finally, the millions of Barbara Lewises there are, I've sort of narrowed it now by adding PhD to my name. And because I'm so interested in this subject and passionate about it, I decided to run a contest called Black Belt. I have a black belt in karate, so I'm using that black belt. PFAC Metrics Challenge 2026. The application deadline is in January, and I'm sending out an invitation for people to apply to this. It's 2025 initiatives that you've done where you've actually proved your value, where you've actually have before and after measurement, and you can talk about how the impact from the Patient Family Advisory Council has improved safety, enhanced the patient experience, or saved the hospital money as well. Thank you.
That was an amazing, very, very insightful presentation. And you didn't even go over time. So that's good. Oh, goodness. So let's open this up to everybody. Does anyone have questions, comments? Bev, I know you've been moderating the chat. I don't know if something's, yep. Okay, so we have one from Karen.
Thank you for that, Barbara. It was excellent and hit on a lot of wonderful things. I'm with the PFAC at Children's National Hospital in DC. And one of the things that I think is often a challenge is how do you help the members of PFAC? They often enter in with their personal individual experience. And you want to be able to, in order to do this kind of measurement, you want to be able to think broadly in terms of policy and practice that affects lots of people. So maybe I wonder whether your research in measuring impact has something to do that you could suggest for like related to that.
Okay. Are
Yeah.
you talking about people bringing their personal experience to the
Yeah.
meeting and that might inhibit measurement?
It doesn't inhibit it, but it makes it hard to get at this is the one story that happened the one time with this one person. And then but in order to get to the measurement and to think about a bigger picture, I want, you need the stories, but you want to know that this story is representative of something larger than just one person's personal one-time experience.
Right. So it's very important to make sure that you have the right people on the bus, which is something that people said to me. And that starts with the recruitment and the interview. So there are a number of PFACs that have been closed because of the fact that there were very disruptive people on the PFAC and they just decided to close the PFAC, which is kind of a shame. I'm actually going to do a webinar on how to deal with certain people. So you want to make sure that they don't have an axe to grind. That's all in the interview process. And people have said to me that it could take over a year to find the right people to put them on the PFAC. And interviewing them is very important. So now the people are already on. The way to get around this is to have term limits. And the majority of PFACs do have term limits. However, most of the term limits are 2 years. And what I've told PFACs is that I think it should be 1 year so that you rotate people off and then they can re-up and reapply so that they can continue on the PFAC if they're good, but if they're not, you can automatically get them off. So here's the research that I did. Is there a defined term of membership? Yes, and 2/3 have that. What is the duration? It's usually 2/3 almost is 2 years, but I'm recommending that it be 1 year and then you reapply after 1 year, 2 years, 3 years. You can go on as long as you want. Does that answer your question, Karen?
It's one way for sure, the upfront and how do you get people off, and then there's the education process when you're in it, of how you
Okay, so the
facilitate the
education
conversation
process.
to say that's a great idea, or is that just one-time experience, or how does that, did you encounter that every time you went to this clinic or
So
something like
we're
that?
We're really not educating PFAC members. Raise your hand, get an interview, and then you're on the PFAC, and that's it. And we don't educate them. And I'm actually doing a webinar in December on this subject because there are some hospitals that have solved this and have education, like how do you tell a story? Or how do you do, whatever it may be, whatever issue you're having, how do you have people talk very succinctly about what they're saying and not talk specifically about their issue all the time, for example. So one of the ways is to use the problem, recommendation, and solution. So here's the problem, talk a few sentences about that. Here's the recommendation that you have, and then here is the benefit that would happen about that. And we need to start doing more educating, I think, of our PFAC members, because a lot of them have never been in a business meeting before. And this is really kind of a business meeting that we're having. As a matter of fact, I was talking to somebody who had 10 PFACs, and I said, which is the most successful? And he said, it's the one with all business people on it. We get an agenda, we go through things, we get things done. Doesn't mean that the stories are lost, but it means that they are complementing the data and the agenda and moving the agenda along.
Mhm.
How's that, Karen? Better?
Sorry, perfect. Thank you.
Okay.
Okay, we have 5 hands up.
Oh, okay, great.
So Emily, do you want to ask your question or?
I wanted to put in a little bit of a success story. Up until January 2023, I actually worked at Kaiser Permanente Northwest onboarding and training and mentoring other patient partners. And a couple of things that were really important was, number one, if it turned out that the person I had contacted had a personal issue, I was lucky to have someone I could refer them to with their permission to get their issue settled. And sometimes that was done and they were happy, they didn't want to participate. And sometimes after that, they became happy patient partners because their personal issue was settled first. Secondly, was to talk to them about what do they really care about? What are they there for? One of the big things that I really had to have good conversations with about people, especially those with professional degrees and professional experience, is that we need you to be the patient in the room, not the professional expert on anything. And I used examples from my own experience as a mediator and facilitator. And then the third thing, I actually developed a storytelling workshop. We called it 2 Facts and a Feeling. How do you tell a story that helps the other person get a sense of what it was your experience, what it was like to walk in your shoes, and do it in 3 minutes or less? And it often helped with other in the situations they were in. But the final thing I would say is one of the biggest challenges that I saw, both as a patient partner volunteer and working there, was where do you get the human and money resources? And so often, depending on the department that was working with us, that made a big difference in how much we could do and the quality of it. That's my
So
story.
Emily, you said the human and the financial resources?
Yeah. Do you have somebody who's, let's say, co-leading the council who actually has the time to make those reports and to make sure that X gets into the
Right.
newsletter? And then do you have the money to have enough people to actually do all the work from the organization side that needs to be done to sustain it?
So what I found in my research is that the average cost of a PFAC is $3,000. And it's, that's a $3,000 outlay. But if you're proving the value of it, you can say, we save the hospital thousands and thousands, a specific thousand amount of dollars. We would like $3,000, for example, to have a dinner at the end or something like that. I also found in the research that the more successful and effective PFACs have champions who have volunteered or competed through an application process as opposed to just volunteering. The ones that volunteered felt that they just had something else to do and they didn't want to do it. So just show a quick slide here and show you that research. So this is the support from the executive, for example, for the PFAC. This is what the PFAC saying, do you have support from the executive? 28, almost over 50% here. Champion, the leader, this is a person who works closely. This is more in the C-suite. But what I found is if the champion is appointed, there's less support than the champion applies, there's more support. Thought that was very interesting.
Yeah. Thank you, Barbara. Thank you, Emily. Connie, we have a lot of
Yes.
hands now. Yes, go ahead.
Hi, everyone. My name's Connie Jastrzemski, and I'm actually partnering with Barbara through our AARP work. AARP started a PFAC network to help PFACs get into every hospital and to get into nursing homes, cancer centers, because it's more than just hospital work, as Barbara has pointed out. We need to hear the voice of the patient everywhere. And so I just wanted to point out that we are partnered with Nurses on Board Coalition as well. AARP did develop a toolkit as well to start an AARP, start a PFAC, and that's on the Nurses on Board Coalition website. And the other thing I would do is invite all of you to join our PFAC network. Next Wednesday, we actually meet via Zoom, 3 o'clock Eastern time. I'm going to put Winona Penn's email address into the chat. She would sign you up to become a part of our network, because many of you can be mentors to the new nurses who want to join a PFAC, or actually you can offer your hospital as a place for these nurses to join. So I'm going to put Winona's email in, and I'll email her today saying she's going to get a raft of emails wanting to join our PFAC network. I thank you very much. AARP is very committed to this work, and we want to hear the patient voice as well. So thank you.
Thank you, Connie. Sumit.
All right, thank you. I have a couple of questions. One is I've had I'm first of all, I'm in Canada. I'm Thunder Bay. I'm in Canada, and I've had some interactions with some of the hospitals, different hospitals, and in some hospitals they are really gung ho about having patient and family advisors as a part of their, their whole structure, and in some they feel that having only a select members, like maybe 5, 7, 10, or whatever the number is, that is not enough for them to have meaningful discussions. And instead, what they feel is that having a set of volunteers where they can actually tie them to an actual project where they can bring in the right kind of lived experience, and they're not just speaking on behalf of others when they may not necessarily have that lived experience, being more meaningful. So that is one, whether in Barbara's case, whether she has had that exposure and experience supporting that that thought process or not. Number one.
Yeah.
Number two. Okay, or go ahead. So let's answer this first before I go into the second question.
Okay.
Yeah.
Yes, thank you for that question. So this is a trend that seems to be going on in hospitals all over the country. I don't know about the rest of the world, but more and more hospitals have now e-advisors, which is where they go out to their EHR and they ask people who will be willing to answer a survey. And thousands of people sign up to answer the survey. And then they send out various surveys between 2 and 12 questions, get the information back. And sometimes that information then goes to the PFAC for more discussion. And actually, the average number of people on a PFAC is 13, according to my research. And the number of hospital people is, I think it was 6 or 7. So when you do a focus group, 8 or 10 people is the ideal amount for a focus group. So that's perfect. But other hospitals are starting work groups specifically around the issue. And I can talk to you about 2 hospitals that each saved $1 million by going out to their e-advisors and asking if they should build a clinic in a particular neighborhood. And in both cases, they said, no, we prefer to go to the hospital, and they each saved $1 million. Now, I found this really interesting aspect that came out of the analytics that I did, and that is that a focused PFAC, and focused is the condition, for example, diabetes, or the person is youth, they're more effective than unfocused. So unfocused is a general for the hospital, and a focus is oftentimes for a particular department. So there tends to be more content, there's more pre-meetings, they measure more the engagement level, and there's 3 levels of engagement. It's stamp of approval, yes, we agree, or there's feedback, and then there's finally co-design. There's more involvement in decision-making, and there's more process and outcome metrics used. So, Samit, I think that we would characterize a work group, for example, as a focused work group, because they are focusing on one particular issue, and they're becoming very prevalent and effective in hospitals. So I think it's a great idea.
Okay, and my second question is that to make the meetings more effective, or the agenda more effective as a part of the discussions that we bring around. So we were thinking of creating a work plan for the year. Now, have you, in your experience, seen an actual work plan which lays out that in the month of January, this is what typically one big topic of agenda would gonna be?
No, I haven't seen that, because what you want to do is you want to leave the agenda time available for people who are working on projects, departments who are working on projects, to bring that project to the PFAC whenever it can come up. So I would say that that's probably not as effective as having an open agenda. Now, there's some hospitals that have so many initiatives on their agenda that they've actually instituted a couple of things. One is that you apply to speak to the PFAC, that you fill out a form on a Google Doc, and then there's a pre-meeting with the PFAC leaders, and then you're slotted in to present at a particular meeting. So, but that is the visibility. If you have good visibility, you'll have more content. But I would say that a work plan kind of defeats the purpose of a PFAC, and that is being available for a department when they start an initiative and they want to come to the PFAC and get some feedback, or they want to co-design something to solve the problem with the PFAC.
See, we've got 11 minutes left to kind of get through the rest of the questions. So Linda, do you want to ask a question?
I do. Thanks so much for this. This is really helpful. And as someone who's running a PFAC, just for a year, this community is really nice to see. So thank you for reading that as well. My question is around the measurement specifically. I was so interested in hear, Barbara, your guidance around specific measurement for PFAC efforts before and after, because what happens in our environment is that there's like a general hospital-wide survey, right? There's just sort of surveys at every juncture. And then sometimes my PFAC is brought in to solve a portion of that, but there's like the broader measurement that then the end result takes into account all of these different efforts, of which we're only one. So my question is, do you have any experience or can speak to how to, I guess, like tease out the specific impact of the PFAC?
So this is
given that there's already so many other surveys. Sorry, go ahead.
Right. So this is a great question, and this has been a conundrum for years on how do PFACs prove their value if customer service was involved and this group was involved and PFAC was just one part of it. So what hospitals are doing now is that they're assigning an effort to each of those, let's say 3, the customer service, the PFAC, and another department. They're assigning effort. So the department that brings the initiative says that the PFAC involvement was 35% and the other one was 40%. That's how they assign a percentage of impact that they feel that each of those departments have. And then you talk about that in terms in your annual report in terms of the impact that you had, and also tied to money. So if you're talking about falls, and we had to decrease falls, and we went to the grievances, and we went to this group, and we went to another group, you know, that can then be calculated in terms of you had 35% impact. That's 35% of falls that you decreased. And what does that equal to in money if our average fall is $45,000? Does that help, Linda?
Yes, super helpful. Thank you.
And if you do that, I'd like to know about it, because I would like some examples of how that impact is allocated across different groups.
You got it. I will report back.
Thank you.
Thank you, Linda. Thank you, Barbara, for answering that question. Alicia, did I say your name right?
Yes. Yes.
Okay.
I'll make mine quick. So one of my projects this past year was to create a Spanish-speaking family advisory council. I'm over at Yale New Haven Children's Hospital. We have a huge Spanish-speaking population. I'm curious, Barbara, in your research, did you come across any other institutions that have more than just English-speaking councils? And I'm wondering how that was, it was a feat for me to get buy-in to get this up and running, especially for a language that I don't personally speak. And I'm just wondering if there's any data that proves how efficient it can be for the institution to have more than just English speaking.
Yeah, I don't have data on that actually, but there's a number of hospitals that I've spoken to that are doing second and third languages because their population, their patient population is a large percentage of that, and they want to get their feedback. So I don't have the data on it, but I will say that there are PFACs now that are only Spanish speaking and other languages as well.
Okay.
Yep. Thanks, Alicia. Thank you, Barbara, for responding to that. Martha.
Sorry, my allergies are really bad, so I'm got a scratchy voice. But this has been such a great presentation and information. I support an inpatient hospital medicine PFAC, and a question I have for you is in terms of changing the culture so that when hospitalists, when staff come to us, they're coming to us earlier in the process and not like, hey, we kind of figured everything out. We just want like a last minute like look over by the PFAC, that stamp of approval. We've been working on encouraging people to come when they have ideas. And it's been a really hard culture change to change it from getting actual true like more engagement versus just the stamp. I just wondering if you have advice on like that culture change for our division.
Yeah, so in my research, what I found is that some hospitals do not allow the stamp of approval. It's actually banned by 2 PFACs that I spoke to. And one person said to me, this is not respectful of our PFACs time and brain to come in and just say, okay, yes, we approve. And you can see the percentages here. So about 3%, this is their main type that they do is a stamp of approval. The second one is the feedback, and less is the co-design, but I think we're moving in that direction. We've got a problem. How do we solve it? And let's use the PFAC to do it. So it's a matter of letting the departments know that this is where you want to be, and that there are hospitals that don't allow a stamp of approval from my research. And being in on department meetings, which I know there's a lot of people who go to department meetings, they hear things and they say, can we bring that to the PFAC and ask them about it? And everybody is very receptive about that. It also helps when you have a leader who wants to have the patient feedback right away and early on. So one VP I was talking to said to me that if an initiative comes into his office and people are interested in starting this initiative, he always says, where's the patient voice? And people know in the organization that if you're going to bring an initiative to the VP to get permission to do it, you better have a patient involved with it as well. So that, I think that's important to, from a cultural standpoint, but also you can just inspire people to come early. And if you were doing a newsletter, for example, in the hospital and saying, you know, here's a department that came to us and here's the impact and we co-designed something, then it would put it in people's mindset that this is what you're doing. Does that help?
Yeah, thank you.
Okay, Jonathan, I think you're going to be the last person to go for it.
Yeah. Hey, thank y'all. One, I'd just like to say, Barbara, thank you for this. We at Kaiser Permanente are working with Barbara on really looking at metric methodology and you know, how do we not just embed that into the work that we do when we think about PFCC, but how do we then spread it to all of our advisory councils? I think it's some of the most important work that we're doing right now in our PFCC program. And I think Barbara beautifully laid out the reasons for that. So I loved today again. I kind of geek out looking at a lot of this data, so I appreciate it. I'd also say Emily Newberry spoke just a little bit ago, and one of the things that she talked about was patient partner education, particularly around how do you tell your story effectively. We do patient partner education workshops, and this was one of them, how to tell your stories effectively. It was really well received, but I think it helps our patient partners as they go into these settings, into settings that they may not have experience in. This really helps them kind of lock in and not spin off in trying to solve their own kind of stories, right? You're bringing your lived experience into this, but we aren't solving your problems. And so setting that expectation, but then also doing training for your patient partner is really important. And I'd say the other thing, I heard somebody talking about meetings, you know, how do you have effective meetings? And it just popped on me. And I know Barbara and I talk about this a lot, but you know, there's a couple things we do. The pre-meetings are really important. So planning, and we believe in the 20-80 rule, right? 20% of time for your presentation, 80% of time for questions and discussion. And we educate people on that. And then a post-meeting survey. I like that Barbara put that up there. We're trying to make certain that all of our advisory councils do that. I think it's super important. So all I got to say, but I appreciate this today and I appreciate the discussion so much. Thank you, Barbara. Thank you, Marie and Bev.
Yep, thank you.
Thank you, Jonathan.
I think we have time for one more. Anjali?
Thank you so much. Thank you so much for this conversation, and thank you for squeezing me in. I have so many questions, but I was going to ask the one question. I was really interested. I came across this idea. I'm looking at my other screen. Credit goes to Children's Mercy. They have a patient and family seal of collaboration program. I've been so interested, and I wanted to know if you have any knowledge of that working and being effective. It just seems like the purpose of their program is to outwardly display that collaboration between, like, this was a patient family approved, or like we co-designed, we did work together, here's this seal. And then I feel like, would that be more, I don't know,
Yes.
encouraging for staff to partner?
Yes.
That's my question.
Yes. I think it's a great idea because
Cheryl is on the call also, Cheryl from Mercy. So if you
Hello.
So I think it's a great idea because you're promoting collaboration now, and that can be used a million different ways. You know, it can be on your website, it can be in a newsletter, it can be used in social media. I think that's great. It used to be a stamp of approval. And of course, we're trying to get away from the stamp of approval idea because that's the lowest level of engagement, the highest level being co-design. So yeah, I think that's just a vehicle for more visibility, which is really great.
Mhm.
And Marie, I just wanted to make a couple of one comment before we leave.
Sure.
Up
Yeah,
here.
no, go right ahead.
Are we ready to leave?
Well, no, we have 4 more minutes. So you can take a
Okay,
minute.
well, I'll do it at the end. So go ahead.
Okay. So, Matt, can you pull up the slides? Okay, so this is something that you can think about after you leave this session. What strategies do you think would be most helpful to use for evaluating patient and family advisory councils and committees or workforces? So, next slide. There was a number of resources shared. These are just a few. I did include the Black Belt in PFACs, which is a webinar series that Barbara does, which is really great. I watched this video on recruiting and retaining great members into PFACs, and it was amazing. So you're going to receive a copy of these slides and from today's session, so you will be able to access these resources. Next slide. We are so grateful to all of our Pinwheel sponsors. And if you want to join and you want to support us, you can also become a Pinwheel sponsor. And you can find more information about that in that email right there. Or no, website, sorry. Or you can email it me at institute@ipfcc.org. Next slide. So many of you are members of our free online learning community, PFCC Connect. If you're not a member yet, we do encourage you to register so you can access the great information and resources about patient and family-centered care. You can post questions, you can learn from others, you can share great ideas and resources, and you can continue these conversations that we had. I know we have a lot of chat today. So next slide. So we ask that you complete the survey, as we do use these results to give us ideas to improve our conversations and determine future topics. You can use the link, which I think Bev will put in the chat, or you can use the QR code to access it. The link will be shared with you in a follow-up email as well. Next slide. Okay, so our next informal conversation will be scheduled for either January or February, and the date and topic will be determined. And people asked in the chat whether or not these, the recording, the slides, and the chat will be posted. And yes, all of this from today's session will be posted onto the PFCC Connect site. And then if you want, and because many of you have wonderful ideas as well. So if there's resources you want to send to us, please, we can share those with others on PFCC Connect. And then finally, we'll continue this discussion in PFCC Connect. And I think it's 1 o'clock, so we're going to have to leave it at that. But Barbara, do you want to say one last thing?
Yeah, just to go very quickly, you may not be doing the measurement, and you probably can't do the measurement. It's the department that comes to you that should be measuring before and after the intervention of the PFAC. But to talk to them about what is your measurement, what are the statistics beforehand, and then are you planning to measure afterwards? Make sure that in the pre-meeting you have that conversation. And don't forget about the contest. Look retrospectively at what you've done in 2025 if you have any great projects that you measured, and enter this challenge that I'm having. And finally, if you have any questions for me, I'm always open to talk to everybody about my favorite subject. Thank you so much.
Thank you, Barbara. Thank you. What a great job. Thank you so much.